We were always striving to improve that case selection. And we were trying to get to those coding errors that would drive that revenue integrity, that compliance, and that coding education. So we knew where some of our denial trends were. That wasn't the problem as much as it was just difficult to know, well, which one of these encounters are in those DRG trends that were most likely to have the coding and documentation issues. There were then those unlikely, unusual DRGs that would pop up, and those cases that we didn't code that often that just fell off our radar. So that was another challenge. And that led then to another challenge that was those lack of real-time insights in those trends. And we know that those lack of trends can really be challenging for us as we're trying to be timely about educating the revenue cycle and correcting those issues before they lead to that revenue leakage and denial. So it was really critical for me to get those trends and those opportunities to be able to collaborate with those other departments like CDI and coding and billing and financing. So when my auditors were going through the audits, it was not really uncommon to find opportunities for revenue integrity that really needed to be shared throughout the entire revenue cycle, including providers. So those could have been clinical documentation issues. I found we had issues in order entry, some in IT. So when I speak about IT, I'm talking about those problems where we're finding that the EMR needs to be optimized because we know as coders, if it's not documented, you can't code it. So that was something we had to really work through in our journey.